somebody this diagnosis. So the epidemiology of autoimmune hepatitis is somewhat variant. In Alaska, 35 per 100,000. In Japan, 15 per 100,000. I don't think we have data in Pakistan. All the Dr. Zagam is sitting here, and I pulled up an article that he had from SIUT, where he looked at HLA association in Pakistan, but I don't think we know the prevalence of autoimmune hepatitis in Pakistan. But it is there. Over the last 1 year, I've seen a couple of cases of autoimmune hepatitis, and I can tell you that I got a referral from Dr. Tayyab on a very, very challenging case, and we had to spend enormous time to figure out if there was a toxic agent that that person was taking that was causing autoimmune hepatitis. And we actually assigned one of our residents to do a grand round from that case. So it takes time to really establish a diagnosis of autoimmune hepatitis. So HLA is important in autoimmune hepatitis, and HLA is actually associated with the immune system, so with the adaptive immune system. And these are the points that are more important, the DRB and 0301 and 04001. These have been more extensively reported in a large proportion of patients who have autoimmune hepatitis. So in Europe and North America, if somebody has autoimmune hepatitis and has 0301, it actually means that this person is going to have more treatment failures and more requirement for liver transplant. If somebody has 0401, their prognosis is going to be better. And similarly for type 2 autoimmune hepatitis, you will have LKM antibody positive and you will have a 0301, and they also don't have a very good prognosis. On the other hand, if we see in South America, this HLA locus and this allele 1501 is protected in the United Kingdom. So there is some value of doing HLA. I think Dr. Zagam was able to put the data together on HLA because he was in a kidney transplant center and they had all the HLA done on all their patients, and some of them had autoimmune hepatitis, so they were able to study them, and he actually had some of the D loci that were highly prevalent in those cases with autoimmune hepatitis, and they had a control group as well. So autoimmune hepatitis, like NASH, is a multifactorial liver disease that makes life interesting actually when things are multifactorial. They're not that simple. So there can be, it's gender related, to typically females have more autoimmune disease. Age, you can see it at young age, you can see it at very old age. So it's not that specific, but sometimes it can help. Pregnant women, I'm sure some of you guys have already seen a patient in postpartum who present with autoimmune hepatitis and liver failure. So there is some influence of hormones as well. Ethnicity, in United States we say that Hispanics have more autoimmune hepatitis. In Pakistan, I don't know if we know what kind of ethnicities are associated. There are comorbidities that can be associated with fatty liver as well. I mean, NAFLD is common enough. So if you look at any liver disease, some of them would have NAFLD as well. So you need to know if you're dealing with one problem or two problems. And then there can be drug exposure. These are the drugs that have been more extensively studied, and we have more data on them: nitrofurantoin, minocycline, hydralazine. But there are other drugs as well, particularly over-the-counter drugs and the herbal medicine and conventional medicines that are widely available in Pakistan, and Hakimi medicine. They can be associated with autoimmune hepatitis as well. Hepatitis C is associated with LKM type of autoimmune hepatitis. There's some cross-reactivity between the hepatitis C proteins and the LKM, and that's why it might trigger. Genetic features, we just discussed the HLA-D allele. There are some other non-HLA in the genes as well, like this one. And then there can be cytotoxic lymphocytes, this A4 that has been associated with this as well. And the liver is a very tolerant organ. That's why there's less rejection in liver, and over time, some of the people can even come out of immunosuppression. But sometimes these tolerogenic pathways like the TRAC, this is the regulatory T cell molecule, this can be aberrant. So that can be associated. So basically when you look at a person with autoimmune hepatitis and you identify a particular person who is predisposed to autoimmune hepatitis, so if somebody is predisposed to autoimmune hepatitis, they have a D variant, they have the hormonal status, or they have some other evidence, then they need an initiating event. So they might have an exposure to a drug, they might have a viral infection, or there is new antigen formation. And after that initiating event, the immune system becomes active. The CD4s and the CD8 cells, the immune symphony starts to play. And then you will recruit a lot of T cells that would start causing the damage. And then there's progressive damage, the regulatory mechanisms are all disturbed, the death ligands and all of these cytokines, apoptosis, all these things start to play together to cause liver damage. So we find a lot of antibodies as well in autoimmune hepatitis. I don't think we check for all of them. We check for ANA, we check for smooth muscle antibody, and we check for F-actin. But there are other antibodies as well, like LKM in pediatric autoimmune hepatitis, ANCA associated with ulcerative colitis, and they are against certain proteins which may be present in the liver. However, autoantibodies are not causing pathogenesis in autoimmune hepatitis. It's a T cell mediated disease. So all those lymphocytes that you're seeing in the liver biopsies were actually the T cells that were destroying the liver cells. These autoantibodies, they are kind of an epiphenomena, which means that they are there, but they are really not causing the toxicity. Since the immune system is active, it's producing a lot of autoantibodies, but they help us make this diagnosis of autoimmune hepatitis. So there are two types of autoimmune hepatitis, type 1 and type 2. And typically we see a lot of type 1 autoimmune hepatitis, which is ANA, I lost my pointer. So we have ANA, smooth muscle or F-actin. There is association with the HLAs as well, elevated immunoglobulins, more females. So this is type 1 autoimmune hepatitis. Type 2 autoimmune hepatitis is the LKM1 associated, or LKM3 associated, or liver cytosolic antibody associated. This is more aggressive type of autoimmune hepatitis, and it causes cirrhosis more quickly, and this is more common. So these are the two types of autoimmune hepatitis. Then you have a lot of other autoimmune conditions that can be associated with autoimmune hepatitis as well. So you can have thyroid disease is extremely common. You can have autoimmune thyroiditis present in 10 to 20% of the patients. You can have diabetes associated with that.